Hello, I am Professor Kennedy Edom Kukuya. In this video I talk about a new treatment for Parkinson's disease. Parkinson's disease is a debilitating neurological disorder. It affects millions worldwide. This disease robs individuals of their mobility and independence, but there's hope on the horizon. Scientists are constantly searching for new and effective treatments. One promising avenue involves a class of drugs called adenosine receptor antagonists. These drugs target specific receptors in the brain. They show great promise in alleviating the motor symptoms of Parkinson's disease. I'm sure you've heard the news about Parkinson's disease being a progressive neurodegenerative disorder. It primarily affects the brain's area responsible for movement control, the substantia nigra. In a healthy brain, nerve cells in the substantia nigra produce dopamine. Dopamine acts as a chemical messenger for smooth muscle movements. In Parkinson's, these neurons gradually die. The loss of dopamine disrupts the brain's neurotransmitter balance. This leads to motor symptoms like tremors, rigidity, and slowness of movement. As the disease progresses, daily activities become challenging. The exact cause remains elusive, but genetic and environmental factors contribute. While there's no cure, treatments can manage symptoms and improve quality of life. The striatum, a crucial component of the basal ganglia, is where the magic of movement control happens. But it doesn't work alone. It relies on a delicate dance between two key players, dopamine and adenosine. These neurotransmitters exert opposing effects on movement, and their interaction is crucial for smooth, coordinated movements. Dopamine, released from neurons originating in the substantia nigra, promotes movement. Adenosine, on the other hand, acts as a brake, inhibiting movement. A2A receptors, highly concentrated in the striatum, are intricately linked to dopamine D2 receptors. These receptors form functional units called heteromers, where they can directly influence each other's activity. In Parkinson's disease, where dopamine levels plummet due to the loss of dopamine-producing neurons, the inhibitory influence of adenosine becomes overactive. This imbalance further contributes to the motor symptoms experienced by patients. Deep within our brains lies a group of interconnected structures known as the basal ganglia. They are the unsung heroes of movement control, ensuring our movements are smooth, coordinated, and purposeful. The striatum, the input nucleus of the basal ganglia, receives information from various brain regions, including the cortex. This information is then processed and relayed through different pathways within the basal ganglia, ultimately influencing movement initiation and execution. The interplay between dopamine and adenosine in the basal ganglia is crucial for maintaining this delicate balance. Dopamine, through its actions on D1 and D2 receptors, facilitates movement by promoting the activity of the direct pathway. This pathway enhances movement. Adenosine, on the other hand, acting on A2A receptors, inhibits movement by suppressing the direct pathway and enhancing the activity of the indirect pathway. This pathway inhibits movement. Now let's look at the pharmacological basis of A2A receptor antagonism in Parkinson's disease. The discovery of the intricate interplay between adenosine A2A and dopamine D2 receptors in the basal ganglia has opened up new avenues for developing innovative therapies for Parkinson's disease. A2A receptor antagonists have emerged as a promising class of drugs that target this interaction to enhance motor function. By blocking the action of adenosine at A2A receptors, these antagonists effectively release the brakes on movement, counteracting the dopamine deficiency that characterizes Parkinson's disease. The pharmacological rationale for using A2A receptor antagonists is based on their ability to restore the balance between dopamine and adenosine signaling in the basal ganglia. By blocking A2A receptors, these antagonists reduce the inhibitory influence of adenosine on dopamine release and signaling, thereby enhancing dopaminergic transmission. This enhancement of dopaminergic transmission helps to improve motor symptoms such as bradykinesia, rigidity, and tremor. And now, istradifilene, a breakthrough in adenosine receptor antagonism. Istradifilene, a selective adenosine. A 2A receptor antagonist has emerged as a beacon of hope for Parkinson's patients. This drug represents a significant advancement in the treatment of Parkinson's disease. It offers a novel approach to managing motor fluctuations and improving patients' quality of life. Istradifilene acts by blocking the adenosine A2A receptors in the brain. This action enhances dopaminergic transmission, thereby improving motor function. Numerous clinical trials have demonstrated the efficacy and safety of istradifilene as an adjunctive therapy to levodopa in Parkinson's disease patients experiencing motor fluctuations. In these trials, istradifilene significantly reduced off time. Off time refers to periods when levodopa's effects wear off and symptoms return. It also increased on time without increasing troublesome dyskinesias, abnormal involuntary movements that can be a side effect of levodopa therapy. Istradifilene is well tolerated. The most common side effects include dizziness, constipation, and insomnia, which are generally mild to moderate in severity. The approval of istradifilene for use in certain countries marks a significant milestone in the development of adenosine, A2A receptor antagonists for Parkinson's disease. Exploring further avenues in A2A antagonism. The prelatinant and caffeine story. The success of istradifilene has spurred further research into the potential of adenosine A2A receptor antagonists for treating Parkinson's disease. Prelatinant is another selective A2A antagonist that has shown promise in clinical trials. While its development was halted due to challenges in achieving consistent efficacy, prelatinant's initial results highlight the continued interest in this class of drugs. Interestingly, even caffeine, a widely consumed stimulant, exerts its effects partly through adenosine receptor antagonism. Caffeine's ability to improve alertness and reduce fatigue is partially attributed to its blockade of adenosine A2A receptors. While not a substitute for dedicated Parkinson's medications, caffeine's mechanism of action underscores the importance of adenosine regulation in motor control. The advancements in Parkinson's disease treatment, particularly with the advent of adenosine A2A receptor antagonists, are encouraging. However, the fight against this debilitating disorder is far from over. Continued research is crucial to unlock the full potential of A2A antagonists and develop even more effective therapies. Together, we can pave the way for a brighter future for individuals living with Parkinson's disease, one marked by hope, improved quality of life, and ultimately, a cure.